got Ish with us today. He's a Newcastle student. He's studying dentistry in Newcastle, and he's kindly accepted to come on and tell us about his dental journey, as well as some insight into the UCAT. If you don't know what the UCAT is, you're going to find out what the UCAT is today. Everything you need to know about the UCAT, the insights, some secret tips, hopefully, how to get those big scores. But Ish, no, thank you very much for coming on, and let's get straight into it. Tell us why you wanted to become a dentist. Why did you choose dentistry?
Yeah, so it's a bit like an interview question. It was initially something, I think a lot of people, I think you get two types of people when you apply to dentistry. You get the people who have known from the age of 10 that they're going to do dentistry, and that's all they're going to do. And then you get the people who, around GCSE and A-level time, they're umming and ahhing. And usually it's between dentistry or medicine. For me, it was like a trifecta of dentistry, medicine, and economics, because a lot of my friends were doing economics and wanted to go to London and go work in the city. So kind of umming and ahhing between the three of them. I ruled out medicine earlier on because I think we talked about it briefly, but I quite enjoyed the business aspect of dentistry. Yeah. I kind of enjoy the fact that I've got the option when I graduate to go into clinics, become a clinician, and also have the potential business potential as well. And then it was between dentistry and economics, and I've always swayed more towards healthcare than number crunching. So kind of ruled it out. My work experience further cemented it a bit. So that's how I kind of went through like a ruling out process of it.
Yeah. So I mentioned to know, did you have any family members that are in dentistry or in the other fields, so economics? Do you have family members that are in those areas?
Yes, I've got no one in my immediate family as a dentist, so I'll be a first generation dentist. My sister is a doctor. I've got sisters and opticians, so that's kind of where the healthcare aspect of it's kind of been like infused into our family.
Parents as well?
No, some of the parents, neither of them are in healthcare at all. So it's just my sisters that are in healthcare. So that aspect of going into a healthcare profession has been there from the start. And that probably has had an influence on me. I think maybe why I didn't choose medicine was probably my sister doing medicine might have been a reason behind that as well.
What did she say to put you off?
So she was always like, oh no, if I could go back, I would do dentistry ahead of medicine for her own reasons. But I think it's one of them when you're in the profession, you always find a reason to not like your profession as much as another one.
Yeah.
So yeah.
So you had economics and dentistry to choose from, you were saying?
Yeah, like ultimately, I think when I was deciding my AS subjects, I just chose a lot of subjects because I wanted like to be able to go into loads. So I chose like maths and further maths to open up the opportunities for economics maybe, and then obviously chose the biology and chemistry that you need for dentistry. So I tried to keep my options open, and then it just whittled away really at it when I decided what I want to go into.
Okay, so when you decided dentistry, what then started to happen?
Yeah, so, well, the application process, so mine is a bit of an unusual entry into dental school. So in my first year, like traditionally year 12 where you'd apply, or year 13, I applied to, I can't remember off the top of my head, the dental schools. I think it was King's, Cardiff, Bristol and Sheffield from the top of my head. Was successful in interviews and offers. So it all went swimmingly until results day. And then I missed my offer by half a mark, which is obviously not ideal at the time. I was umming and ahhing between a gap year or not anyway, so I was like, you know what, okay, 100% I'll go for the gap year. Because at the time I had firmed Cardiff and they just held my offer for the following year. So it wasn't too big a deal. It was just the fact that I'd have to take a gap year, which turned out to be like one of the best decisions that I made. So in the gap year, I didn't have the pressure that people might have of like having to resit exams or anything. I just I did some traveling, worked, tried to save up for university, etc. But I changed the schools I applied to a bit. So I didn't even look too far north to even consider Newcastle the first time around. And the second time around, I was like, you know what, I might as well look at the whole of the UK properly. So I looked at Newcastle, Kings again, because throughout school, like my friend wanted to go to London, so I always had Kings at the back of my head. I applied to Kings, Leeds, and it was, I think, yeah, Cardiff again, and Newcastle. And then this time I went to all the unis, and I realised, you know what, I really like Newcastle, so I put that as my first choice.
Yeah.
The second time round, was obviously looking again to get my offers, and
Did
that's
you
it.
get all your offers?
Yeah, so I got my offers again, all of them again. So I was kind of very lucky, I think, in the aspect that every time I applied to dental school, I got into dental school.
Yeah.
And that's kind of what made me want to create like a platform where I could help others get into dental school, because I feel like it was something that I found like the knack of somehow getting the offer.
So what would you put it down to? Why were you so successful at getting the offers? Was it your academics? Was it the way you wrote your personal statement? Was it just how you are in interview? Just looking back, do you have a hunch about what it was?
Yes, I think it's quite multifactorial in the sense I was never like top of the class academics in that sense. Like it wasn't straight A stars, anything like that. But you don't need to be to study dentistry or even medicine. You need 3 A's. And obviously that's not easy to get, but it's not, you have some degrees where it's like A star, AA, 2 A stars and A. Dentistry is not like that. And a lot of dental schools are somewhat lenient on results as well, and let people in AAB, A star, AB. So the academics was okay. It was definitely like not awful, but it wasn't amazing. But I think my personal statement was definitely what got me all my interviews, and my UCAT scores, them two coupled together. But I think like I always advocate having this very strong personal statement, because that's kind of what's going to differentiate you. I think for me personally, when applying pre-interview, that's probably the biggest factor. Once you've ticked the other boxes of your academia, because everyone's going to have the same predicted grades, everyone's going to have similar GCSE results.
Yeah.
And your personal statement is really what's going to make you shine through.
So tell us about how you constructed your personal statement. How did you make it so strong?
Yeah, so I think I was quite lucky in the sense that throughout my school, I was given a lot of opportunities in terms of extracurricular activities. I was always pushed a bit as well by my parents to like do more outside of just studying. So I played a lot of football, played rugby. I was like fortunate enough to be school captain at my school. I did some voluntary work in like British Heart Foundation, Duke of Edinburgh, the usual sort of things.
Yeah.
But I think over the years, when you do that, over like the 2-3 years of doing that, it kind of builds up to quite a big resume of things you've actually done. And you look back at it when you're writing your personal statement, you're like, do you know what, I've actually done a fair bit now.
Yeah.
And then you just cherry pick the things that you think make you stand out compared to somebody else. Everyone's going to have done the same things, but it's kind of more what you've learned from that experience than you actually doing that. So I think if you read through dentistry personal statements, every single person has done some sort of like Duke of Edinburgh or something.
Yep, we've all done it there.
Like the biggest box to tick for everyone. And you can imagine if you're an admissions tutor, you're reading that and you're like, okay, wow, 100th personal statement, Duke of Edinburgh, amazing, well done. But it's more what you've learned from that experience. And translating that onto the personal statement, I think, is the biggest thing. Rather than, I always tell students who ask for personal statement advice, it's not a case of just listing down everything you've done. Just select the important things that you've done and then talk about what you've learned from it, rather than the fact that you've...
I guess that's difficult though, because you feel like everything I've done is important.
Yeah, exactly. Yeah, exactly. And that's why, like, start with your personal statement early. Make a list. Do not worry about the character count or anything. Write down everything you've possibly done. Even if it's something tiny, you can make something that appears quite small into something that you've actually learned quite a lot about, and it sounds a lot better on paper. So kind of just go through everything you've learned and try to build that resume. I think a lot of students have asked me recently, like with COVID, I can't do anything, I can't leave the house. You can do loads with COVID. There's loads of like online courses you can do that are free. A lot of food banks, charities are looking for volunteers, especially at this time. So kind of like be proactive. And I think that's what you have to do to get into dentistry. You have to be proactive.
It's the time to be volunteering. You know, you want to talk about you do volunteering. This is the time where people are needed to volunteer. So you're quite right there. Did you have any help with your personal statement, whether it was family or friends?
I think the bulk of it I kind of made myself, and then obviously, like, I think everyone has the same work through school. your tutor, whoever it is, will do some sort of checking of it. But I think the way they work with schools is that you're going to give it to an English teacher or someone, they've got no experience in dentistry, they don't know what dentistry is, they're just checking it simply to check for spellings and like if you're using the wrong words, etc. I gave it to my sister to read over, but once again she doesn't really know what dentistry is, coming from a medical background. I think a lot of it, just either if you can go through someone who's been through the process before, to have a look at it. Also go through someone with a completely different set of fresh eyes to have a look at it from a non-dental perspective. If you have the opportunities to do something like that, or like go through a student or even your own dentist. I didn't quite go through that route, but I had a couple of different people just check it from different backgrounds.
That's
just
good.
So I can pick up different boxes.
That's good. And I mean, you're giving out some good advice here, and I want to find out how you prepared for your UCAT. Maybe even share your UCAT score if you don't mind. We're going to really go into the UCAT when we talk about the book you've written on the UCAT, but I just want to hear about it from, you know, how you approached it.
Yeah, absolutely. So I always say, like, with the UCAT, it's such a different exam to anything you'll have done before. I think the only thing I can compare it to is if people have sat the 11+ grammar test before going into a secondary school. It's somewhat similar in terms of the cognitive stuff you need for that, but it's so different, and therefore respect the exam a bit. A lot of people think they can just rock up with a couple of weeks of revision and do quite well, and you might do well, who knows, but to give yourself an actual good chance of doing well, I would always say start with about 46 weeks worth of revision. I think the UCAT consortium recommends around that time as well.
Just briefly tell us, without getting too deep into what the UCAT is, just for people that are not aware.
Yeah, so it's the examination. It's like a psychometric cognitive ability examination for applicants of medical and dental schools throughout the UK and also worldwide now. A lot of non-UK countries require the UCAT. And it's just another method of effectively dental schools whittling down the numbers. You can imagine thousands of people are applying. You can't interview 1,000 people. It's just another way. So a lot of unis will have it as a cut-off score. In which they say the score is 650 or something. If you come below that, they're just not going to look at any aspect of the application. They'll just get rid of you.
Okay.
Which seems really cutthroat, but they kind of have to be in order to get rid of the numbers.
Yeah. So you're saying everyone's pretty much got the same A levels and GCSEs. Everyone's pretty much got, you know, a lot of people got strong personal statements. There's too many. So how do we cut that down? So let's introduce an aptitude test, and then the top scoring people. Okay, let's see those.
Exactly. And I think be savvy about it is advice I'd give to people applying for dental school, because not all dental schools look at the UCAT the same.
Yeah, that's good.
And some dental schools, Newcastle when I applied, King's and a few others, who only looked at quite high UCAT scores. Others only look at it after interview, in the sense that if they have two really close candidates, they might look at the UCAT score then. And then there's also a situation judgment test on top of the UCAT at the end of the paper, which is kind of ethical medical scenarios and how you'd respond to them. And increasingly now, more so than when I did the UCAT, they are looking at that score now. So before, when I did it, I think it's graded band 1 to 4, and people kind of could get anywhere. Don't get band 4, but if you get band 3, you'll be fine. And now a lot of the medical schools and dental schools need you to get at least a band 2, if not a band 1.
Okay, so when you did it, was it the UK CAT?
Yeah, it was the UK CAT.
Showing the age there.
Yeah, exactly. We're ancient.
Yeah. So, okay, I'm guessing it was, when you were applying, it was a new experience to you. How did you approach the test?
Yeah, so I think like a lot of people do at the moment, I looked at YouTube first. Everyone, because it's just a free way to get an idea of what to do, instead of going straight into buying a book or whatever. Just look at YouTube. There's loads of really good channels, tips. Yours is one of them, to give out tips. And then I kind of I looked at Amazon. Just got a textbook which has got a load of questions basically. And that's the best way to prepare for the UCAT is to do as many questions as possible. Yeah. So I think it was one of the Kaplan textbooks, which I'm not endorsed by any of these, by the way. I'm just saying what I got. And then they kind of go through like little tips to approach different sort of questions and just get through the questions.
Yeah.
And I'd say in your first week of UCAT preparation, don't worry about the timing, because the timing is really difficult in the UCAT, but just try to use that first week to get to grips with the type of question you're going to be asked and how to kind of approach them. So just treat it as you would like not even in time conditions at all.
Okay, so how long did you give yourself to prepare for it? And I want to know what it was. Do you still remember the experience of sitting?
Yeah, exactly. Yeah, so I gave myself, I think, about four weeks, maybe a touch more than 4 weeks.
Yeah.
And I split it down, and I go over this in one of the blogs that I have, into like week 1, where it's just come to terms with the exam, kind of familiarize yourself with the sort of questions. Don't time yourself at all, because you'll just be so stressed, because the time conditions are like 20 seconds per question. And if you first look at the paper, you're never going to get that. So don't worry about that. Just get your techniques first. And it's all about getting them techniques to start with, because then the more you practice, the more them techniques will get embedded. Yeah. And some questions will just become second nature, where you just know the answer without even having to do a calculation. You'll just know how to get there. And then slowly work your way. It's a bit like progressive overload, where you slowly build yourself up. And the ultimate goal is you peak into that 4th week or that 5th week. And that's your exam week.
Okay.
And then, so the way the exam works, and it's actually quite stressful. I think some of the stress has been taken off it for this year, because students can sit the exam from home. Yeah. Because of the COVID situation. But when we did it, it would be in like a driving test center, where you kind of just put into your little cubicle, put your headset on, and you just have to do the exam. You get pen and paper allowed, an on-screen calculator. It is quite a stressful environment in that exam center, because you're surrounded by random people. But it's less so this year, so I think applicants are a lot more lucky this year.
How were you with your score? So I think what I did, I got maybe about 670. It was average. It wasn't anything exceptional, but it was enough.
Yeah, so I think I was quite lucky. I got 773 as my score with a band 1, the situational judgment.
Yeah.
But I think an element of that is always luck with the UCAT, and I'll always say that there's only so much you can provide, but you do need a bit of luck to get a really high score.
But you were intentional with your approach to it. It's not something where you just turned up and expected to do well. Exactly. You're intentional.
Yeah, I'd say like your preparation will get you 95% of your overall grade, or 90%, and then that extra little bit just to like maybe get you into like the really high scores, and will be that little bit of luck that you need with every sort of examination.
You got into, or you got your offers, and you ended up choosing Newcastle. But do you live near Newcastle? What was the appeal for Newcastle?
Yeah, so it's quite. I live 3.5 hours from Newcastle in Birmingham.
Okay.
It's not close at all, but I think at the start of applying to dental school, I fell into the trap of, I want to go to X dental school, and at the moment it was King's for me. It's always King's for some reason. I was like, I really want to be in London. I have to be in London. And then I realised, what? It doesn't matter where you go to dental school, because ultimately in the next 4 or 5 years you'll learn exactly the same content.
Where do you think that obsession comes from? Because you're not the only one. Everyone's looking at league tables, and where does that Russell Group universities, where does that obsession come from? Why are we so bent on, we want...
It's from the fact that you're applying for dentistry, but your peers around you in your class and in your year are applying for other degrees, where you kind of do need to look at league tables and rankings and Russell Group, because they dictate the kind of job you're going to get.
Yeah.
For example, if I was going to do economics at university, I'd want to go to, ideally be in London, because that's where the economic sector is. I'd want to be higher in the league tables, because that's going to get me a better job. But with dentistry and medicine and stuff like this, it doesn't matter, because wherever you go, you'll get the same job when you graduate. The chances of employment are pretty much the same at near to 100% wherever you graduate from.
Yeah.
In your first foundation year, your salary is exactly the same as everyone else, regardless of how well you do in the course or what part of the country you do the course. But I think because throughout your education, you're in that mindset of your other peers who are applying for other degrees, of looking at league tables, I need to be in this city to do this job. It kind of gets embedded into you, and the quicker you can get rid of that when applying dentistry, the better it will be for you.
That's good. That's good. Okay, so peeling the layers back, then, what should a student, an aspiring dental student, pick? What should they look for in a university, in a dental school?
Yeah, so I think the way a lot of students look at it is a lot of people want clinical contact, so that impacts them. So whether it's early or late, I think there's pros and cons to both. If you do it early, a lot of people feel quite unprepared.
Yeah.
Into clinics in first year. At Newcastle, you kind of learn the clinics in second year, thrown in third year, which is what I preferred. I think the biggest thing that I would say is the city that you're going to be living in, because you're there for 5 years. A lot of people usually stay on to do their training year in that city a lot of times, and 5 years is a long time. You want to be happy in the place you are. That's kind of what ruled me out of London, because I just couldn't see myself being there for 5 years. Financially, being there for 5 years, and like the layout of the city just didn't appeal to me. It might do for others. I think that would be the biggest thing. Look at the rankings maybe if you want. I think location geographically from your family home is also an impact.
Had you ever visited Newcastle before? Was that your first experience, the interview and then dental school?
So it was quite a coincidence. My sister just moved up to Newcastle like the year before.
Okay.
So things kind of just weirdly worked out, but it was never intentionally planned to be like that.
Yeah.
So yeah, I think there's loads of factors, but ultimately you'll get a feel. Try to visit the university as well,
Yeah.
and you get a feel for that, and you'll kind of realize where you want to be and where you don't want to be quite quickly.
Okay, I just want to, before we move on to the experience of university at Newcastle, I want to touch on the interview. So tell us generally about your interview experience, and then mainly focusing on how it was at Newcastle, because I guess I haven't really heard many experiences of students going straight from sixth form or college to dental school. So what was your experience?
Yeah, so I applied to, and I would advise people to do this again, I applied to 3 MMI interviews, the majority of them MMI, and then panels.
So what are MMI?
Yeah, so it's a multiple mini interview. It's been adopted quite recently over like the past 5-6 years, where you have loads of different stations. So some will have 5-6 stations, some will have up to 10 stations, and you have about 5 minutes at each station, and they test different aspect of your abilities. So some would be manual dexterity, some will be how to interact with patients and role playing. Others would be like a more dentistry NHS type question or something like that.
Yeah.
The pros of it are the fact that if you do really bad in a station, you can just forget about it and it doesn't impact your next station.
That's it.
I think a lot of people, you can have like a car crash interview where as soon as it starts going bad, it goes bad for the rest of it. Whereas with MMI, you just leave it behind at the previous station. And you can do bad at stations. In my MMI interviews, I definitely did awfully in at least 1 or 2 of the stations, and I still.
Do you remember what it was?
Yeah, so I think it was Cardiff. I had a really tough IQ station, and I was just like, "What is going on?" Like you just don't know what to do, and it was a complete car crash of a station. But I left the station. I was like, "Do you know what? Okay, the examiner in that station is not going to liaise with any other examiners. The next station doesn't know how bad I just did.
Yeah.
For them, I've done amazingly, and I've got to keep that confidence up into the next station. So you just approach the next station with a big smile on your face, like you've smashed the previous station.
Do you feel like the questions at the interviews were similar across all the dental schools you went to? Yeah, would you say the questions were very similar?
No, which was what was the tricky bit. I think the MMIs, they are just so versatile. You can, like, I'll use Cardiff again as my example. Throughout each station in Cardiff, MMI was incredibly different to the previous station, and they kind of just really, really do test different aspects of you and how you deal with pressure more so than anything. And then my King's MMI was a bit more, the questions I felt were a bit more traditional. And then Leeds was also completely different again. So I think I wouldn't adopt a blanket approach to the MMIs and think, you know, just because I've got these 6 set of stations in my 1 MMI, I'm going to get the same again. Because a lot of times there's a lot of variance to it.
Yeah. And would you say that your confidence grew as you did each interview? So you'd had 2 rounds of interviews.
Yeah.
Essentially. So do you think that things got easier the more interviews you did, or did you get to a certain point where it didn't matter that you did 3 or 4 interviews, they were all now, you were just as prepared for any of them?
Yeah, so I think the first interview is always going to be the most stressful interview because you've been waiting for this moment for like 2 years now, and it's by far going to be the stressful interview. And once you get that one out of the way with, the interviews come quite thick and fast if you're lucky enough to get a couple of interviews, and you kind of just go into like a little mode of churning out the interviews. I think, yeah, so the first interview is definitely the most stressful, and then I kind of got into quite a, I've survived the first interview. I'll go on to the next one, and then a lot of people, if they're lucky, will get like an offer from their first one before another interview.
Yeah.
In which case, your confidence is through the roof because you've done well, and you just kind of repeat the same sort of performance.
Okay,
I
fantastic.
think it's quite good I think it's quite good to reflect as well after your first interview, and kind of just like make a note of what went well and what didn't go well, and just focus on the stuff that didn't go well, because whatever went well, it's kind of inherent in your system now. You're going to do the same again.
Yeah.
But focus on stuff that didn't go well.
So, I mean, listening to you, you articulate yourself quite well, and a lot of students might not be confident at speaking. It's actually a big part of being a dentist. What would you say to that in terms of, students haven't really had interview experience as such, you haven't had to during school. So what do people do to get to a place where they're confident articulating their thoughts and opinions?
I think that's a really good point. And the way you present yourself for the interview, I think, gets you so much further than kind of almost what you say sometimes. Yeah. If you can walk into an interview and you've got that energy and that confidence about you, you've kind of already convinced the interviewer that they want you. And then it's kind of just like saying a few words that will align with how you look and what you say in your personal statement. I think practice makes perfect with interviews. Try not to go into your first interview completely blind. Try to do some sort of a mock interview. Yeah. Before, even if that's with a family member, a teacher at school, just be proactive again, like try to get someone to interview you. Just create some basic questions for them to ask, and more just focus on how you're going to articulate yourself well. Yeah. How you can avoid saying are like a lot of fillers, because a lot of students that I've interviewed in practice interviews do kind of just say an for about 2 minutes, and you're not getting much information out of them. So yeah, practice before you interview. Don't go into your first interview completely blind.
Yeah, very good, very good. So I guess to tell us about Newcastle Dental School, what can somebody expect from studying dentistry there?
Yes, I'll go through from the start. So I chose Newcastle as well because it's a panel interview as opposed to an MMI. A panel interview, for those who don't know, is more of a traditional interview. You just walk into a room, there's 2 or 3 people in front of you, they'll just ask you questions for about 10, 15 minutes, and that's it. It's a very simple interview. Newcastle, a lot of the time, they kind of just want to match everything you've said on your personal statement, your application, to who you are in person. And I think more so than anything, it's a personality test at Newcastle, and they want you to reflect everything you've said there. And if you can do that well, you'll get the offer, in my opinion. Newcastle is a really good dental school to go to. I'll give a little plugs here. It's really good. The way it works is the first 2 years is predominantly theoretical. After the Easter term of your second year, you'll begin to learn your clinical studies, and then from 3rd, 4th, and 5th year, you'll kind of progress into more advanced clinical treatment.
Yeah. When do they introduce you to the equipment, to the handpieces? When does that happen?
Yeah, so you get us in your first year, you get like a real tiny teaser of like doing some suturing practice. You get to shadow some of the older years on clinic, and that's kind of it for first year. It's quite limited in first year, and in second year you're given a drill and a handpiece to hold for the first time. You haven't got a clue what you're doing, and you're really bad. But you get literally from Easter through till mid-summer, so through till mid-July, you have every single day you're practicing, and your skills develop a lot. Like, I was awful at the start. I'm not amazing now, but I've definitely improved a lot more since Easter. And it's quite progressive.
Okay, so how many of you start in your year group in dentistry, and then how do the groups work?
Yeah, so there's 72 of us per cohort at Newcastle. At the moment, we don't have 72. We probably have around 65, I think, roughly. I'm not too sure, because people don't quite make it after first year or second year, or some people drop out. You're then split into seminar groups for your seminar studies, and then in your clinical years, the year is kind of divided into two and half in half, something like that.
Okay. What would you say are some highlights of studying in Newcastle, and are there any, disadvantages? Is it the weather? What other? Give us a feel of Newcastle.
The best thing about studying at Newcastle, or at least the feel that I got from when I went for the interview and then throughout the past 3 years being there, is it's a very, very chilled out dental school. And I got that vibe right from the start, and that's kind of what made me go towards Newcastle. It's a really laid back environment. It's almost like a bit of like a family affair, really. You get to know, from first year, you get to know people in years 4 and 5 quite quickly. And you form a relationship with your clinicians quite quickly as well. And that's what I liked about it. And that's what I like about these smaller dental schools, is it's more of a close-knit feel.
Yeah.
And that really does help going through the degree, because you've got people in the years above you can rely on for support, and people in the years below you can rely on support as well.
Yeah.
Negatives, I don't know, maybe some might say you might want to have some more hands-on experience in first year.
Okay.
But I feel like there's only so much of that you can really incorporate whilst trying to get the theoretical side of it in as well.
Okay. What's the societies and extracurricular like? The dental society, what sorts of things do they put on? What can you get involved with as a dental student?
Yeah, so I think most dental schools, Newcastle included, have got their own specific dental society, and usually they're quite popular. The dental school at Newcastle, it'll be a social every Friday or every other Friday, and it's probably the best way to get to know people in years above and below you. So that occurs every Friday. It'll be both alcoholic and non-alcoholic activities, trying to really incorporate everyone else. They've started a newer society called Dent Ed, which is like an educational society where we get guest speakers come in.
Okay.
A lot from the years above. Say in my third year, I'm going to go into my human diseases exam. Students from fourth and fifth year will host a lecture in which they kind of cover some of the content for that human diseases exam. It's a bit more personal than having it with a lecturer. It's a bit more laid back. So we have stuff like that. I think a lot of dental schools really pride themselves on their dental society.
Yeah.
Every year there's a sports day with all the clinical years from all the UK dental schools, where we meet up in a city. So last year it was in Sheffield. I think this coming year it'll be in Manchester, I think. And you meet everyone from all over the UK.
Yeah.
And then Newcastle in particular, we have once a year again, we have another social with Dundee and Glasgow dental schools.
Yeah.
Where we drive down to a dental school and have a bit of a sports day there as well. So there's loads to do outside the degree. I think loads of people stress before dentistry that it's all work. It really isn't all work. You really, really need to find a balance quite quickly, I think.
No, that's really good there. In terms of being at Newcastle Dental School, do you feel like you've got time to really do extra things like sport?
Yeah.
You know.
Yeah, I think that's the biggest misconception people have before going into dentistry. It's definitely a tough degree, there's no doubting that, but it's not impossible to do loads of stuff. And I think, if anything, it's harder to not do stuff outside the degree than to do stuff outside the degree.
Yeah.
You're not at uni all day. Even in first year, like, you'll be at uni, it's not 9 to 5 every day. You'll be at uni, say 9 to 12 or 9 to 1. You have the whole day to do other stuff. And really, especially those in first year, get involved, because it's the only way you're going to really meet new people and people who are more like-minded. So get involved 100%. Do not be scared that you're going to fall back on your studies, because it's more than possible.
And as we come to a close of this segment, this part, I want to hear more on your perspective on dentistry. Has that changed from when you were applying, now that you are a dental student? How do you see dentistry, and what do you see for your future as a dentist?
Yeah, absolutely. I think it has changed actually since I started. Obviously, when you start, you don't really know much about the different specialities. You kind of know like drilling and filling, and that's kind of, you have a basic understanding of dentistry. but as you progress through the course, you find stuff that you really like and you find stuff that you hate. I think every no dental student will like every specialty. That's definitely, I think I've definitely taken a liking more for oral surgery,
Okay.
and down that sort of route. And like, I'm not too much of a fan of like other aspects, like perio, for instance. It doesn't really appeal to me, but I can see why it can appeal to others. It doesn't really appeal to me, and I think you do just tunnel your vision a bit more. I think maybe when I graduate, I'd want to go down the oral surgery route. In terms of business, so yeah, I came into dentistry. I think I thought there'd be more exposure to like going into business post dentistry whilst at dental school. But obviously, there's none of that. You're not really exposed to any of that. I can see why, because obviously, healthcare first, business second is the approach. But maybe if we had a bit more of like, even like extracurricular sessions and just like people who do want to go into maybe opening a practice or something like that down the line. I'm not sure what your experience with something like that has been.
Yeah, definitely. Dental schools are there to teach you the clinical side and to make you competent as a dentist. I think there's probably not enough room in the curriculum for them to start fitting in something like the business side to dentistry. But I really think the business side is essential for every dentist, because you can be the best clinician out there, but if nobody knows what you can offer them, you're not going to have as many patients as you should have to provide that service that you can provide so well. So there's so many different things with the business side that will complement your clinical side and make you actually effective in providing that service to as many people as needed. But I would say connecting with dentists and specialists, even at the dental school stage, and shadowing them or just talking to them, I think that gives you an idea about the business side and what to start thinking about alongside your clinical side.
I think ask questions to your clinicians, because they've been through everything before. They're quite high up in their profession. I think that's only something I've recently got to do a bit more, is like question them more about their personal dentistry rather than just what they teach at university, because they've got a whole life to dentistry outside of the university and a whole like system. But I didn't realize half the clinicians I have own a practice, for instance. You just don't know these things until you ask the questions.
Yeah. No, thank you for that, for this segment. Just that people can find you. Where would people find you?
So the program that I run, of course, is called the Dental Portal. So we've got a website, www.thedentalportal.co.uk. Also on Facebook and Instagram, the same tag, the Dental Portal. Most active on Instagram. It's mainly a lot of blogs to help students coming through, as well as the UCAT ebook that we have, and personal statement interview services as well. So yeah, they're the best ways to find us.
Perfect.